Good evening, everyone. This is Marrero with Western Marketing. I'm a health marketer with Western Marketing. Today's topics are going to be differences between short-term medical and ACA. What is ACA and what are short-term medical? How to quote them and what carriers we offer. What is short-term medical? Short-term medical are temporary health insurance coverage that provide health benefits to people who are not enrolled on an ACA or group major medical plan. These plans usually provide the similar level of benefit as an ACA plan without the minimum essential coverage or MEC. And what are MEC? Minimum essential coverage are benefits added to a normal major medical that people used to have before Obamacare to provide high level of guarantee issuance and also a added benefits such as pregnancy, substance abuse benefits, and many others. The policies that we offer on short-term medical plans are very similar, like I said before, as an ACA plan. You have your typical 80-20 co-insurance with $5,000 to $25,000 maximum out-of-pocket expenses. You will find that they range from $250,000 to $1 million to $1 million maximum benefits, with copay plans for doctor office visits and specialists. First dollar benefit for vaccination for children, and also no limits on or no deductibles if you go to an urgent care facility. Who's eligible for and what durations these plans have? Hourly workers without access to company benefits, self-employed individuals in today's gig economy, workers stuck on a COBRA, or workers employers that are waiting for a 90-day waiting period. You also have these people qualifying for people who are leaving a employment and that the spouse is being left behind. Children that are aging off of parents' plans and they are turning 26 as well. These plans used to have a 3 to 6 month duration, but during the Trump administration, these plans were extended to be able to offer a 2x12 or 3 years with no gaps in coverage. At Western Marketing, we have several providers. One of those providers is National General, which is one of our main companies that we use here. National General has a 36-month benefit on selected states. They have a large network, Aetna's PPO network. Children are able to apply on this policy for as low as age 60 days of birth. They do have prescription benefit embedded in the policy, in some, guarantee issuance with no health questions, and they range from $1,000 to $25,000 maximum benefit on the deductibles. You have a $5 million lifetime maximum benefit. And then you also have United Healthcare, which is well known by many. They do have a large network, United Healthcare Choice Network. They do also offer doctor office specialist copay, prescriptions. All providers are accepted. You do not have to be a citizen to qualify for this plan. And they have coverage maximum of up to $2 million. The third company that we will talk about is Pivot Health. Pivot Health coverage also 24 months on selected states. No doctor office network, meaning that you can go to any doctors you want. They do offer some benefits that offer some networks, PPO, Cigna is one of them. They're very flexible. They only have 5 health questions. And then children can also get enrolled on these plans for age 6 months and above. For quoting and enrolling these plans, I'm going to take an example of one of our main carriers, which is National General. National General will give you access to getting contracted. Once you get contracted, you'll be given a link to create a username and password. You're going to put your NPN number, create a username and password. Once you have created the username and password, then you are able to get into the quoting system. Once you get into the quoting system, you enter a zip code, click go, and then a second page will show up where you're going to enter the census information for the client. Once you enter the census information on the client, then you'll get your quote. On this quote, you will be able to see your deductibles, your coinsurance, 50/50, 80/20, and 100% coinsurance. What is an ACA? ACA, or Obamacare, as many know, was enacted by the 111th Congress and signed into law by the President of the United States in 2010, Barack Obama. These plans make affordable health insurance available to many people. The law provides consumers with subsidies, premium tax credit, that lower cost for households and income between the 100 percentile to 400% of the federal poverty level. It's 600% in California, and it expanded Medicaid program to cover all adults with income below 138% of the federal poverty level. Texas has not expanded their Medicaid program in this case. Support innovative medical care delivery methods designed to lower the cost of healthcare generally. These plans has an open enrollment between the periods of November the 1st to December the 15th. United States, the plans that we offer here at Western Marketing, carriers that we offer are Bright Health, Amber, Medica, Molina, Blue Cross Blue Shield, Cigna, Friday, Anthem, and Oscar. How do you get ready to quote and enroll on an ACA plan? The first thing that you need to do is get contracted. Once you get contracted, then we will ask you to go into the federal training or the CMS Enterprise portal, where you're going to go and create a username and password on an FFM. Once you create your username and password, then you go to the broker's training link. Once in the broker's training link, then you return to the training link and go to the windows of MLMS. Update any outdated personal information, business information you may have in there. The marketplace will update your information. Then you click and save that information and proceed to the MLMS training landing page. Once on the landing page, go to the curriculum, then click on marketplace training, and then go to your modules. Once you have created those, have done your training, we will give you access to a system called 𝗪𝗂𝘁. And this system will allow you to be able to quote and enroll on many of those companies that we gave you access to on the previous page. You click on that sign in, and then create a username and password. Once you have entered your username and password, then you go into the landing page of the 𝗪𝗂𝘁 system, where you're going to be able to see client information, leads, referrals, marketing information, and many others. Once you have been in the system for a while, then and you're ready to be able to quote from people, then you go and click and quote. Once you quote, you'll be able to get into the census information for the client. You're going to enter a zip code. Then once you enter the zip code and the house and how many people in the household, you're going to be able to enter the amount of the household income And then you'll see how much is the saving for these people. In this case, I choose a couple in a child in Nebraska with 3 people, 35-year-old, with a household income of $45,000. Once I have entered that information, I go into the plan design. And with this information, I'm able to save $270. That's my cost sharing information. They have expanded a bronze plan, which has an $84 premium because of that benefit that I'm getting on the subsidies, with a $7,000 deductible and a maximum packet of $8,300. You do also have doctor office visit and a specialist visit. And you can actually check and see if your doctors and what the prescription benefit that you have, the prescription taken are available during this plan. If this plan doesn't work for you, you move to the second plan. And that's how you enroll on Obamacare and short-term medical. I want to thank everyone for watching this video. We love to hear from you, your thoughts. My name is 𝗪𝘂𝘁. I'm a health marketer with Western Marketing, and I'm going to be very happy and willing to help you in any of your questions. Thank you very much. Have a great day.